Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
and together
therapist.
we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we're going to talk about some back pain types here. We think it's really important that you know this because it's going to determine how you treat your back.
Right. That's
And
an important concept.
I think it's really good because we're opposites.
Yeah.
Surprises.
Exactly.
So we'll talk about, are you a flexor? That's me. Are you extender? That's Brad. Are you a shaker? I could come up with another name.
Yeah. Now we've got them completely confused.
Or a compressor.
Right.
So we're going to show you in this video how you could check to see whether or not you're a flexor or an extender.
And most people will be a flexor.
Right.
And it'll make sense to you by the time we're done with this video.
Right. Flexor is by far the most popular.
Common.
Yeah, common one. And extender, I would say, would be the second one.
Right. As you age, you become an extender oftentimes.
Right. So flexor is the most common part. If you're a flexor, you will answer yes to most of these questions.
Okay.
Right. Is your back generally worse when you've been sitting for a while?
Right.
You know, or when you get up from sitting
Right.
after for a while. You know, you're that person that,
It hurts when you straighten up until you walk for a little while.
you always make a noise whenever you stand, right? Next, is your back pain generally worse after prolonged bending, like if you're in the garden or you're bending over to make the bed?
Yep. Like me,
Vacuum-
I'm washing the floor a lot. I'm scrubbing the floor bent over.
Yeah, I bet you are. Digging, ironing.
Yeah,
all
anything
those
where
things.
it requires that bending forward.
Especially when your back is in the what we call the C position, Brad. Can you? I'm rounded out here
Yeah, round it
versus
over.
keeping the back straight.
Right, yep.
The C position is the bad position. So, is your back pain generally better with walking? If you're a flexor, a lot of times the pain is going to feel better when you walk.
Right, right.
So, and we would recommend it actually.
So if they answered yes to, 2 to 4 or all 4 of those, then that's going to help determine how you're going to treat your back pain
Right.
so it gets better consistently.
Yeah, and one last one, Brad. If it feels better when you lie down,
Sure.
which probably for a lot of, if you're a flexor extender, it may feel better if you lie down.
Right.
So, a lot of people with a herniated or bulging disc are flexors.
Yeah. In other words, it gets worse when you do those activities we went through.
Right. So we will show you a video that you can do a simple test to see if you have sciatica. That'll be coming up in the future too. So, number one, we'll show you a test here too. You can do one. You could just do repeated flexion. Bend over.
And this is what a McKenzie test.
Right.
And McKenzie's, famous in the therapy world for
You
this.
can do it seated or you can do it standing.
Yep. You do this, and usually you do 10 of them. And if you're a flexor, a lot of times before you even get to 10, it's starting to hurt, and then you stop.
You mind grabbing the stool, Brad? Would you grab and do? I want you to sit on there, and you're gonna first test it, bending.
Okay. Yep.
Bend.
So flex the back.
Yep. And then extend the back,
Yep.
and then keep it straight.
Sure. Yep.
Now you're gonna do it with grabbing the seat pan.
Yep. Grab
So
here.
that way he can put pressure through the back while he's doing the same test.
Right. So if I'm up tall with good posture, I can grab the chair or the legs and pull down. So I'm compressing the low back spine. And then
So
test that compared to
flexion.
slouched. And then pull.
All right.
And if you go way back and then pull again.
So I'm curious, does that hurt when you go back?
No.
Yeah, yours is more a factor of time, right?
Right. Or if I did extreme force this way, which
Sure.
I can't. But so if you are like this and you pull down, it may hurt and make it worse. And then for sure you're a flexor.
Right. And sometimes it does take time or repeating in order for it to hurt on a flexor.
It's pretty common actually.
Yeah.
So
All right. So are you extender? This is
so what if I'm in a flexor? What do I do?
If you are a flexor,
Yeah,
we're
that's what
going to
people-
show you lots of things
Okay.
in this video program. By the way, this video is part of a series of videos
Oh, sir.
on back pain. You go to bombandbrad.com, go to the program section, look for the one on back pain, unless you have sciatica, then go look for the one on sciatica, and you actually are going to watch the ones that pertain to you.
Right.
And in addition,
Oh, PDF printout
Right.
on all these. You click the button, print it out. You'll have the exercises on the printout and a review of the video, so you don't have to go back and watch it. It's a wonderful thing, completely free. Not having an email. It's free.
right. Okay, now are you an extender? Brad's an extender. Now, one of the first questions we ask a lot of people, because a lot of people are older when they're extenders, but not all.
Right.
Absolutely not. Brad just did a video on gymnasts, and you developed the pain when you were how old?
Oh, in my 30s or 40s. I don't remember exactly when, but
Long time ago.
yeah. It happened with whatever, an accident. But
If you are over 50, it's going to be an increased likelihood that you're an extender.
related to stenosis, if you ever get
Yeah.
diagnosed with that, you probably irritates your back to do this or stand for a long period of time or even walking long period
Yeah,
of
if you
time.
have that diagnosis of a spinal stenosis, you're probably an extender.
Right.
Or if you have Brad's diagnosis, you would say, Brad.
Spondylolisthesis, it's
Right.
a mouthful.
And you can get that at any age.
Right.
You're also probably going to be an extender. If your pain is worse after you've been extending for a while,
So extending means bending backwards if you're not quite sure of that. Anything where your back goes backwards.
right, like you with painting the ceiling
Yep,
or
washing windows, painting the ceiling,
Right.
Waving up at airplanes for a long period of times. Then it's like, oh man, that really hurts. And then when you sit down, it almost always feels better.
right immediately. That's
Yep.
that's a sign.
Yep.
Is your pain worse with walking or running? Brad went through a period of time where he couldn't run. He would get pain down his leg.
Right. Or walk. I could walk 3/4 of a mile consistently, and my leg was kind of numb. And so I would stop, and I've improved it with exercise since then.
Yep, and it coincides with shopping cart syndrome. It feels a lot of people feel better when they can lean on a shopping cart.
Right. Or anything.
A
but-
slight bend, right?
Yeah,
you have
and
a
then
slight
it
bend.
relieves it.
So the one test you can do, you can simply stand up, Brad. Won't we do it on you?
Sure.
And you're going to stand up. You're going to extend it. You can bring your arms back, or you can actually extend to the right.
Go. Okay. But you can put your hands on.
yeah,
That's what I
Don.
like to do.
And
over
then
the-
have someone push down through your back,
Right.
or extend to the left. Just have somebody push down.
Right.
Or if you're alone, you can just use your arms up and
Yeah.
like that.
Or you can repeat 10 times. Now with
Yeah.
me, those tests didn't hurt, but I know if I do this 10 times,
10 times you'll feel it.
yeah, it's already starting to irritate it after 3 or 4.
So stay tuned. We'll show the next video. We'll show you how we can determine whether or not you're a shaker or you're a compressor.
All right, so these are 4 common scenarios with low back
Yeah.
pain, and once you determine where you fit, it's going to help you know what exercises to do or
Yeah,
not to do.
you really don't even to know your diagnosis to some extent. I mean, because this is what's the important thing.
Right, the treatment is going to be very similar.
All right, check it out. Thanks for watching.
Good luck.